This segment of DelmarvaLife is sponsored by TidalHealth.
Did you know that every 40 seconds, 40, someone in the U.S. has a stroke? And for those affected, every second counts. Early recognition and quick thinking can make the difference between life and long-term disability, or maybe even death.
On Tuesday, we talked with Dr. Chris Snyder from TidalHealth about May being National Stroke Awareness Month and how TidalHealth is spreading that awareness all across Delmarva. Well, today we're going to dig a little deeper with TidalHealth neurosurgeon Dr. Sophia Shakur. Doctor, thank you for being here.
Thanks again for having me.
Yeah. So we talk about stroke a lot, but I want to start with the basics. What exactly happens when someone's having a stroke?
So very simply, a stroke is a sudden injury to the brain, and it usually involves a blood vessel in the brain. That's why it's so sudden. In other words, there's a sudden blockage of an artery in the brain, or sometimes a blood vessel in the brain can rupture or burst and cause a bleed.
We're talking about an extremely complicated organ. Is there something we can kind of look for as a preliminary indication that they may have had a stroke?
Yes, so because it's a sudden injury, you're going to get some sudden problem. So a person will suddenly have trouble speaking or moving their arm or walking, or suddenly lose their vision. So those are the basic signs.
Really quick.
And there's an acronym, and it's Be Fast. And we talked a little bit about that before, but can you explain what each letter means?
Sure. So Be Fast, it's an easy acronym to remember, and it helps people remember what signs to look for to recognize a stroke. So B stands for balance. So if you're having trouble with balance or walking or dizziness, that's one sign. The next is E for eye, so vision is a very important sign. If you have loss of vision, that might be a sign of a stroke. And then fast, so F for facial droop, A for arm weakness, S for speech trouble, and then the T is the key, because that means it is time to call 911.
That is a biggie, the time. Why?
Yes, time is extremely crucial and important in a stroke for two reasons. The first is a stroke is an injury to the brain, so you don't want that injury to continue for too long. That's why it's important to quickly get treatment. And the second reason is our stroke treatments are actually time-based. In other words, if a patient gets to the hospital quickly, then we can offer more treatments. However, if they come a little later, some of those treatments might not be able to be given.
Wouldn't be effective.
Like anything else, I imagine there's more people who are more at risk for having a stroke, and they can reduce that risk with lifestyle changes?
Yes, so there are certain things that each of us individually can control to try to prevent a stroke. So some of those things are your blood pressure. That's why it's important when you see your primary care physician every year. You know, they check your blood pressure, they treat you for hypertension. Sometimes they'll send you for lab work, blood work that tests your cholesterol level. So controlling your cholesterol, your diet. If you're diabetic, it's very important to control your blood sugars. And then if you happen to be a cigarette smoker, that's another reason to try to quit.
So we're out of time, but I want to ask you real quick before you go. When it comes to the recovery after a stroke, what does that typically look like?
Yeah, rehabilitation after a stroke is very important. It's really key because it makes the most out of the treatments that you had at the hospital. And recovery from a stroke can be long. So up to a year, we tell patients, hey, you know, there's still a chance that you're going to keep getting better for roughly up to a year after the stroke.
Wow.
A lot of good information, and especially recognizing the symptoms or the signs of a stroke. Dr. Sophia Shakur, TidalHealth, thank you.
Wonderful talking to you.
Yeah, thank you.
Thanks for stopping in.